Good afternoon, welcome to today's update. I will start as usual with today's statistics. There were 734 cases reported yesterday, which is 7.6% of the total number of tests that were carried out and takes the total number of confirmed cases now to 106,904. 213 of today's cases were in Greater Glasgow and Clyde, 135 in Lothian and 95 in Lanarkshire. The remaining cases are spread across 9 other health board areas. There are 1,012 people currently in hospital, which is a decrease of 3 from yesterday, and 46 people are in intensive care. That's 1 fewer than yesterday. Finally, no additional deaths were registered in the past 24 hours of patients who first tested positive over the previous 28 days. I would, though, remind you that registration offices tend to be closed at weekends, so the figures that are reported for deaths on Sundays and Mondays are often artificially low as a result of that. Since last Friday's update, 41 deaths have been registered, which takes the total number of deaths under this daily measurement now to 4,111. Of course, that figure reminds us again why we really do need to keep the virus under control. It still causes heartbreak to families across the country, and I want again to send my condolences to everyone who has suffered loss as a result of it. Now, tomorrow, as I usually do on a Tuesday, I'll make a statement in Parliament on the outcome of the latest review of the levels of protection that apply in each local authority area. For today, though, there are 3 items that I want to take the opportunity to update on. The first is to say that from today, the Protect Scotland app can now be downloaded by any secondary school pupil. Previously, you had to be at least 16 years old to have the app downloaded to your phone, so only older secondary school students could download it, but now it's available to all. Downloading is very straightforward. It takes less than 2 minutes to do, and the app's already been downloaded by more than 1.7 million people across the country, and it has notified more than 20,000 people of the need to self-isolate. And of course, that will include people who would not otherwise have known that they had been in contact with a positive case and had to self-isolate. So by downloading the app, young people will be helping to control and mitigate any outbreaks amongst young people, and I think that will be particularly important over holiday periods. I realise that there won't be many, if any, secondary school students watching this right now, but if any parents or grandparents are watching, please encourage your children or grandchildren to download the app. It is a simple way that all of us can help tackle COVID. Second point I want to highlight is that the next stage of the vaccination programme in Scotland is now underway. In the past 6 days, more than 18,000 vaccinators and health and care workers have received the first dose of the vaccine against COVID. And today, the first vaccinations of care home residents and staff are taking place. 90-year-old Annie Innes became the first care home resident to get the vaccine at the Abercorn House care home in Hamilton, and my thanks go to her. She will be followed in the days and weeks to come by many others. Care home residents and staff are being prioritised for vaccination from our current supplies of the vaccine. That's obviously a hugely important step in protecting many of the people who are most at risk from this virus. From Wednesday, we will provide weekly updates on the progress of the vaccination programme. So today we have further good and positive news, but it is still important for me to stress a couple of things. Firstly, that our progress in vaccinating people obviously depends on the supply of vaccines that we get. We are very hopeful that other vaccines, in addition to the Pfizer one that is being used now, will soon meet the stringent health, quality and effectiveness standards set by the regulatory authority. And these vaccines include that developed by Moderna and the one being developed by Oxford AstraZeneca. If these are approved, that will obviously further increase our ability to vaccinate people. For the moment, however, and this is the second point I need to stress, although today is an important day and gives us all yet more hope for the future, we are still some way off a complete return to normal life. COVID still presents a real and present danger. The figures we report every day are evidence of that. We are not yet out of the woods. That's the case not just for us, but for countries around the world. Over the weekend, we've seen, for example, Germany announce a further very stringent lockdown, and there's speculation that this week the whole of London will go into England's highest tier of protection, which includes full closure of hospitality. So with most of the winter still ahead of us and this virus still circulating here at home but also globally, it is more vital than ever that we all stick to the current guidelines and restrictions to keep each other and the country as a whole as safe as we possibly can. And that leads to the final point I want to raise, which is about the forthcoming Christmas period. As you know, as we've set out before, the rules on household gatherings are being changed for a 5-day period from the 23rd to the 27th of December to allow meetings of up to 8 people from up to 3 households in a bubble. That is a pragmatic step that seeks to ensure that the decisions some people will feel they have to make over Christmas are as safe as it is possible for them to be. But meeting up with other households indoors is not risk-free, and I have a duty to point that out very clearly. So I want to remind everyone once again that just because we can visit people indoors over Christmas on a limited basis doesn't mean that we have to. Any indoor meeting between different households obviously creates a risk. The virus will not take a break over the Christmas period, so don't give it the opportunity to jump from household to household if you can possibly avoid it. However, if you decide that it is essential to meet other people over Christmas, now is the time to start thinking about reducing unnecessary contacts that you might normally be having between now and then. And that's particularly the case if you are planning to meet up with any elderly relatives over Christmas. So, for example, if you usually have a weekly catch-up with a friend in a cafe, perhaps decide not to have that catch-up this week or next week. If you are car sharing at the moment, which of course is something that is always risky and we are advising against, try not to do it over the next couple of weeks in particular. By doing all of that, by taking precautions to cut down on unnecessary contacts. Obviously, there are necessary contacts, work-related, for example, that some of us have to make. But if we cut down unnecessary contacts, then we reduce any chance of getting the virus and inadvertently passing it on. Final point about Christmas that I want to stress, and I'm sorry that I am starting to sound like the Christmas killjoy here, might sound obvious, but it is really important, and that relates to office parties. Obviously, if you can't work from home and you're sharing a workplace with colleagues right now, I understand why it might be tempting to have some sort of celebration or social gathering at work, because this obviously has been a really difficult time for everyone. But office parties, especially if they involve alcohol, present a real risk of transmission. People are less likely to stick to physical distancing requirements than when they're working, and more likely to pass around food or drinks without perhaps washing their hands as carefully as they should. So I'm asking everybody, please don't take these risks. By far the best way of marking Christmas with your colleagues this year is to do it virtually. It is not as much fun, I appreciate that, but it is much, much safer. And if you can't do that, then perhaps think about postponing your Christmas celebration until into next year, perhaps the spring or the summer of next year, when hopefully we will be starting to see some greater normality return to our lives. I know that all of this is really hard, especially at the end of a horrible year, when I think everybody could do with letting their hair down a bit, but these times are not normal. And it is really important that we get through them as safely as possible. So please think about the risks and avoid them as much as possible in the interest of keeping yourselves and others safe. Hopefully, by this time next year, all of this will be starting to feel like a really bad memory. But this year, I think it is the case that the best Christmas gift we can give family and friends is, as far as possible, to keep our distance and keep them safe. And finally, fundamentally, all of us at the moment need to think every single day about how we keep ourselves safe and each other safe until the vaccination programme becomes much more widespread. So for the moment, that means sticking to all of the current rules and guidelines. If you're in any doubt about what they are in your local area, you can use the postcode checker on the Scottish Government website. But in summary, nobody outside of islands and level 1 areas should be visiting each other's homes except for essential purposes, caring responsibilities, for example. If you are meeting people from other households outdoors or in indoor public places, remember the limit. There should be no more than 6 people from a maximum of 2 households in these groups. As I said a moment ago, try to avoid car sharing because we know that the enclosed space of a car can give particular risks of the virus spreading. Work from home if you can. Download the Protect Scotland app, and now that includes everybody over the age of 11. And finally, remember facts, that the key rules that we can all use to reduce our chances of getting the virus or of passing it on. So wear your face coverings, avoid places with crowds of people, clean your hands and surfaces, keep 2 metres distance from people in other households, and self-isolate and get tested if you have any of the symptoms of COVID. By following all of these rules, we are all minimising the risks to ourselves, but we are all also helping to keep others safe as well. So my thanks to everybody for continuing to take these very important steps. That concludes the update for today. As you can see, I'm joined today by the Health Secretary and the Chief Medical Officer. So without further ado, we will move straight to questions today. And the first question comes from Alison McCallum from STV.
Thank you, First Minister. You've obviously just been speaking quite a bit about Christmas, and there's a growing number of medics from across the UK that are speaking about their concern over easing of restrictions at Christmas and the impact afterwards and the risk that that poses. Obviously, you share the concerns that they have. Do you think it would get to a point where Christmas easing would be reconsidered because of the level of concern and what could happen? And also for Dr. Smith, the positivity rate is currently hovering around the 5% mark, which the World Health Organization says is a signal of whether it's under control or getting out of control. Do you have concerns that it's just on the wrong side of the 5% as we're going into easing restrictions?
Thanks, Alison. I'll hand over to the CMO in a second. I'll take the Christmas point first of all. Look, we're not planning to change the arrangements that we set out, a couple of weeks ago now, but I will probably every single day between now and Christmas stand here or in Parliament and urge people to be cautious and sensible. The easiest thing for all of us if we just all stayed in our own houses all the time and didn't see anybody, but I have to couple that determination to persuade people to limit interactions as much as possible with a pragmatism about the pressures that Christmas presents to families, particularly those who have loved ones that would otherwise be on their own. And I can't, as First Minister, I can't simply bury my head in the sand about that. So instead, we've tried to put some suggested boundaries around things. And if it is the case that you feel it essential to see a loved one over Christmas, then to set out the advice that tries to make those interactions as safe as possible. That is about limits of people, trying to keep the duration of any interaction as limited as possible when you're together, making sure that you're thinking about things like ventilation, open the windows, wash your hands, don't share cutlery or crockery, just take all of these precautions. So that's, I suppose, the pragmatism that I just have to be conscious of. But that doesn't change the fact that I am very, very clearly saying to people that if you can avoid these interactions over this Christmas period, I am suggesting that that is what you do, because there is no risk-free way of interacting with other households. Certainly, if you see other households outdoors rather than indoors, that is certainly less risky. And as I've spoken about personally, that's probably what I will choose to do this year. So if you can avoid it, please do. We are going into a period that is really, really difficult, not just because of the festivities around Christmas, but also the winter period. As we go deeper into winter, then the risks of transmission increase. And I suppose the final point I would make, which is segueing into your question to Gregor, we've seen cases reduce in Scotland over the past few weeks. The level 4 restrictions across the Central Belt have helped to do that. But as everybody can see every day, we are still reporting a high number of cases. And that is a reminder, and must be a reminder to all of us, that this virus is out there, and nobody can say that they have if they are interacting with others, have no risk of getting it and then of passing it on. And, you know, you're right that over the past week or so, 5%, we've been hovering around that in test positivity, but it's above 7% today. So again, there is no room for complacency here. We are still in a daily battle against this virus, and that is not just true for us, it's true of countries right across the world. And, you know, in Scotland, we have this challenge, but, you know, England's struggling with it just now. London is likely to go into a high level of protection today. Wales has a significantly higher level of the virus than we do right now. But all of that should be a reminder that we have to be on our guard every single day right now. Gregor.
Thanks for your question, Alison. I mean, there's no one indicator that we keep an eye on just by itself. There's a whole range of indicators that we continue to chart, and the percentage positivity is only one of the suite of indicators that we're looking at just now. What we've seen with that particular indicator is that it has gradually reduced in value over the last few weeks as we've seen the effects of particularly the level 4 restrictions coming into play in some of our larger local authority areas, and there's been a gradual fall off in the kind of larger figures that we were seeing associated with that, driven by those larger groups of population as well. But that's no reason to be complacent. It still, as you say, is around about the 5% mark, and it could change very, very quickly if we're not careful, if we take our eye off the ball at any point in time. So not only do we keep an eye on the percentage positivity, but we continually look at the cumulative incidence ratio that we're seeing each week as well, those 7-day figures, to try and get a sense of where there might be rising cases in any area. Towards the end of last week, what we published was the latest estimate of R in Scotland, and that's now estimated at between 0.7 and 0.9. That's encouraging as well, but as I say, it doesn't take an awful lot for that to suddenly run away from us again. And so my message very, very clearly to people is, please continue to be cautious in terms of your approach, in terms of the way that you meet with others, particularly just now as we approach this period of Christmas where you may be coming into contact with others. Don't take unnecessary chances with those that you love.
Graham Stewart from the BBC.
First Minister, when you look at the situation in Germany, when you look at the situation in London, would you say you're even more concerned about Christmas now than you were 2 weeks ago when you set out the guidelines? And I'm just thinking about maybe people in Tier 3 areas of England. Would you urge them not to come up to Scotland to visit relatives this year? And secondly, in England, they're starting to vaccinate over 80s in their own homes. When will that be possible here?
I'll hand over to the Health Secretary on vaccination in a moment. I think we are the first part of the UK to take the vaccine into care homes as of today, and obviously we will roll that out as vaccine supplies allow us to, but the Health Secretary will say a little bit more about that. I've been concerned about Christmas probably for most of this year, although that concern has increased the closer to Christmas we've got. It has always been a period that if we were still in the grip of this virus, it would pose increased risks for us. So I wouldn't say I'm more concerned now than I was 2 weeks ago. I am concerned about it, and I've set out the sort of pragmatism that we've had to have account of as we try to encourage people to really be cautious and not to interact with people that they don't have to interact with over the Christmas period. And that would apply in terms of people travelling as well. If you don't have to have somebody travelling from another part of the UK, or if you don't have to go to another part of the UK, my advice is don't do that. The more we minimise the use of these flexibilities that are there for those pragmatic reasons, then the less the risk will be of us seeing a spike in transmission that may happen for a variety of different reasons, not just Christmas. I mean, that pragmatism, I don't pretend to stand here as an expert on all of the restrictions that were announced in Germany over the weekend, but as I understand it, even there is some relaxation over the Christmas, the sort of heart of the Christmas period. And I think that pragmatism is something that all countries are having to factor into their decisions. But, I think between now and Christmas Day, I'm not saying I'm going to be standing here on Christmas Day. You can probably take some relief in that. But between now and then, I will just take every opportunity to try to persuade people. Think really carefully. I know that for some people, the thought of leaving an elderly relative alone will be just too much for them. So if you have to see them, keep it safe. Keep it as limited a duration as possible. Follow all the other precautions I've been talking about. But if you can avoid it completely, certainly indoors, then please do that, because hopefully this time next year, as I said a moment ago, this will all be a bad memory or beginning to fade into a bad memory, and we'll be looking forward to a Christmas that is much, much more normal, where we're not having to think about all of this. And I suppose what we should be thinking about this Christmas is how do we ensure that everybody we love is still there when we get to next Christmas, and that we're not losing more people to COVID along the way. It's really, really tough, and I think the next couple of weeks are going to be probably the toughest for a lot of people, even after everything we've been through, which has not been easy in these last 10 months. But being apart from loved ones is going to be difficult over the next few weeks. I understand that, but we've got to stay focused on keeping people safe as far as we possibly can. I'll hand over to the Health Secretary to give a bit more on the vaccine.
Thanks very much. People will have heard us talk about this before, where we've said that we follow the recommendations of the Joint Committee on Vaccines and Immunisation. And one of the things that they said was the most important people to vaccinate as quickly as you can are elderly in care homes and care home workers, alongside, of course, patient-facing NHS staff, and then all NHS staff, and then those over 80 in the community, and you work your way down through the age ranges. You've also heard, I'm sure, us talk about the particular issues around the Pfizer vaccine, which is the only one so far approved, although we're hopeful about the Oxford AstraZeneca and the Moderna one becoming approved by MHRA very soon. The Pfizer vaccine has particular issues around its transportation, but also around the size of the pack that it comes in. So it comes in already made up in a pack of 975 doses. We need particular permission, and we've managed to work with MHRA to get this permission to reduce the pack size so that you can take it in smaller quantities into care homes. And that's what started today. Our hospital pharmacies are reducing the pack size. That's got to be done under particular conditions to make sure the vaccine stays stable and can then be used, and to minimise waste. And then our NHS staff take it into care homes. As that continues throughout this month, we will, as soon as we then possibly can, depending on deliveries and supplies, then move to vaccinating those over 80 who live in their own home or who can attend the local GP surgery. And on Friday, I had a really productive conversation with the Royal College of General Practitioners about exactly how that would be organised when supplies allow that, and how much they very thankfully are cooperating and helping us to work through the logistics of that. So we'll move to that group, but right now we continue to vaccinate our NHS staff, and from today our elderly residents in care homes and care home workers.
Phil McDonald from Global.
First Minister, just looking for some information on testing care home visitors. Do you know how many care homes in Scotland now have lateral flow testing kits? And do you have any figures on the number of visitors who were tested last week?
I don't have those figures in front of me. The Health Secretary may have more information on that.
So I don't yet have the number of confirmed visitors tested last week, but we will, as soon as that is a confirmed number, we'll make sure that you and others have that. But over the weekend, we sent out the lateral flow testing kits to 1,076 care homes. So that will cover them all, including those who were obviously the Pathfinder care homes last week. The remaining batches of that went out on Saturday morning. All of that is designed so that from today we can begin to roll out lateral flow testing for visitors, designated visitors in all care homes. And where a care home isn't quite ready to do that, there may be some issues around the physical infrastructure of the building in terms of having a space where a visitor can wait safely whilst the test is done and they get the result. Then we've got the PCR test there as backup for them. So that is underway across all our care homes from today, and it will be fulfilled gradually over the rest of this week.
Peter McMahon from ITV Border.
Good afternoon. Thank you very much, First Minister. First Minister, in your party conference speech, you promised that everyone working in the health and adult social care in Scotland would get a £500 bonus, and you called for the Treasury to make it tax-free. The Treasury said they weren't going to do that. So I just wondered if you could tell us, is that still the commitment? Will those health workers get £500 extra, or will it be a £500 payment that has some tax taken off it? Or are you looking at increasing the payment if the tax is on so that it ends up as £500?
I covered this on Friday, actually, in some detail, but I'm happy to do so again because I don't think you were on the call on Friday. There are some very important reasons why it is not straightforward for us to top up the payment so that people are compensated for the tax implications and still get £500. Firstly, we don't hold all of the tax information for all of the people that will get the bonus. That information is held in many of these cases by HMRC, so it's not possible in a practical way to do it. Secondly, if we were to do that, I think the cost of that over and above the cost of the £500 bonus is another round about £100 million. And what would happen is that the tax from that would flow initially to the Treasury. And then the way the fiscal framework operates, it would be, I think, 2023-24 financial year before that money flowed back to the Scottish Government. So the Scottish budget, including the health service, would take that hit of around £100 million for a period of 3 years, while the Treasury did the reconciliation. So clearly for these reasons that's not practical. The third reason why it's not as straightforward as that is that as soon as it is taxed, the implications in terms of the relationship with benefits kicks in, because that is something that we don't have control over. So the simplest way of doing this is for the Treasury to exempt the payment from tax and any knock-on effects for benefits, and we are still calling on the Treasury to do that. The commitment to give the £500 bonus to those who've worked so hard in our health and care systems is still obviously there. That money will be paid within this financial year, but for it to be tax-free, the easiest, quickest and most effective way is for the Treasury to agree to exempt it, and I would repeat my call today to them to do that. Katrine Bussey from PA.
Hello, First Minister. I wanted to ask, with a no-deal Brexit now looking increasingly likely, how concerned are you about how this will impact on the fight against coronavirus and hopefully the country's recovery from the virus?
I'm not going to get too far into Brexit today, obviously, firstly because this is a COVID briefing. Secondly, uncertainty still shrouds the Brexit talks. I would like to think the mood music from yesterday's update was a little bit more positive than it has been over the course of the week, but clearly there are still some issues to be resolved. I hope we do get a deal. I think any deal at the moment is going to be very minimalist, and therefore there will still be disruption and an economic impact, but clearly a deal, any deal, is better than no deal, and I hope the Prime Minister manages to resolve the issues that are outstanding and deliver what he always said would be really easy to deliver, which is a trade deal with the European Union. Clearly, we talk a lot about winter right now, the increased pressures and risks of transmission of COVID over the winter, the other pressures that the NHS always faces at winter, the risks of flu or other viruses, bad weather, for example, which can increase pressure on the NHS if people are falling on ice, for example, and bad weather can create other pressures for our road and travel networks as well. So we've got plenty to be worried about and preparing for and trying to mitigate over the winter period without having to be thinking about Brexit as well. Unfortunately, we don't have a choice over that. I convened a meeting of senior officials in the Scottish Government last Thursday to look at the Brexit risks. Frankly, I wish that wasn't necessary, because all of my time and effort right now should be on dealing with the unavoidable risks of COVID in winter, but that is the situation we are in. And, while if a deal is struck, it might mitigate some of those impacts, unfortunately it's not going to take them away altogether, and the Scottish Government will do everything we can to get through that end of the transition period as effectively as we can, but there will be some things that are completely out with our control, unfortunately. Paul Hutchin from the Daily Record.
Hi, First Minister. Two questions. At a COSLA leaders meeting last week, they agreed a motion or an amendment which basically stated that local government workers should also get the £500 thank you bonus. So I was just wondering why you thought that well-paid doctors should get £500 while low-paid council staff shouldn't get anything. And secondly, you might have seen George Fuchs has written to Ofcom about these briefings. He doesn't want them to continue in the run-up to the Holyrood election, and he believes that they should be fronted by a public health official rather than yourself. I was just wondering what your reaction is to that.
Look, whether I will do the briefings, because I think I've got a really important responsibility as First Minister to communicate public health information to the public. Whether they are broadcast live is not a matter for me, that's a matter for broadcasters, and I'm not going to comment at the moment on that. I think the only thing I would say is George Fuchs has never wanted these briefings to happen, which I think is regrettable, because it suggests that political considerations are more important than the vital imperative of communicating directly to the public in a public health emergency. But that's for him to answer for, not for me. On the issue of the COSLA motion, I think those who have worked in the front line of the NHS and social care have, and lots and lots of groups of workers, from supermarket workers to delivery drivers, to people working in our schools, teachers and other school staff, for example, and a whole host of other professions, have all had a really tough year, and we can never thank them enough. I think all of us recognise, and we demonstrated this when we stood on our doorsteps week after week earlier in the year and applauded, that those in the front line of the health service have have had a particularly tough job, and that's what the £500 payment is meant to be a thank you for. It is not intended in any way to downplay the contribution of others. It's just intended to recognise the particular contribution of those in the NHS and social care. Obviously, the Scottish Government, through the NHS, is in a more direct employment relationship with certainly the NHS workers. Social care workers tend to be employed by local government, and beyond that, obviously, local government are employers of other workers, and it would be up to them, of course, whether they wanted to replicate the position of the Scottish Government. But we'll continue to look for all and any opportunities to show our appreciation for the contribution that different groups of workers have made over a really difficult period. Tom Peterkin, P&J.
Good afternoon, First Minister. I was wondering if you're able to say what the impact of care home cases, in particular Inchmarlow in Banchory and Deeside in Cults, in particular, have been on Aberdeenshire and Aberdeen's tier status, and to what extent are they responsible for the two areas' COVID figures at the moment?
Obviously a question we will be considering carefully over the course of today and into tomorrow, when the Cabinet will decide the outcome of the weekly review of levels. CMO might want to say a word here. We see cases continue to rise in Aberdeen City and Aberdeenshire, and test positivity as well. That's obviously a matter of real concern. The outbreaks in the care homes that you mentioned will be having an impact on that, but certainly I am not convinced that they are the sole reason for the increase in cases there. So obviously Aberdeen and Aberdeenshire will be areas that we are looking at very carefully before we take the decision that we take tomorrow.
Thanks, Tom. All around the country, as we gather this data, one of the really important things is to set it in the context of the local intelligence, what's happening at a local level, that the directors of public health and their teams are able to determine from the conversations that they're having in their local health care systems. And one of the things that we look at is what contribution to the data is made from discrete incidents, whether that be within workplace settings, within care home settings, or within any of these institutions where you might find cumulatively an increased number of cases starting to come through. So that's all taken into consideration when the National IMT meets to discuss this, and they form a view as to the relative contribution. But what we shouldn't lose sight of and what we shouldn't forget is that whether it's a workplace outbreak or whether it's a care home outbreak, what's happening in those institutions is generally very reflective of the kind of background community incidents. So if you've got high levels of background community infection, then it's far more likely you'll get these type of outbreaks either in care homes, workplaces and schools or wherever. That's why it's really important that we're taking notice of these, and that's why it's important that we respond to that by making sure that there's adequate restrictions in place to try to control and contain the infection at that local level.
Thanks. Christine Lavelle from The Sun.
Thank you, First Minister. The minutes of the latest meeting of the COVID-19 advisory group say that there should be a timeline setting out when it will be safe for rules and behaviours to change to tackle the potential assumption that non-clinical interventions are no longer needed now that the vaccination programme has started. When do you anticipate publishing a timeline for when restrictions can be eased, and how concerned are you about people potentially dropping their guard now that the vaccine's being rolled out?
We'll look at publishing a timeline, or the best estimate of a timeline, as soon as we've got greater clarity about supplies of the vaccine. You know, it would be impossible to do that right now because due to factors beyond our control and beyond the control of the other governments across the UK, we don't know for sure how much vaccine that we will have when, because we're still waiting on other vaccines being authorised, and we're still obviously dependent on the supplies that we're expecting coming through. So it would be premature to do that right now, and it would be giving people, I think, false information, which I don't think is helpful. Of course, I worry about people dropping their guard. All of us dropping our guard. We've been living with this for 10 months. It is wearisome. It's difficult. It's causing a lot of people a lot of mental stress and worry and anxiety. And as I said a moment ago, however difficult it's been over the last 10 months, I think for a lot of people the next couple of weeks will be the most difficult period yet, because we are going into a period when we normally, all of us, like to spend time with loved ones, including loved ones that we might not see, you know, regularly for the rest of the year. So it's tough, and I think it's understandable that people are just thoroughly scunnered and fed up with it. And, you know, if it makes anybody feel any better, which I don't expect it will, I feel utterly scunnered and fed up with all of it as well. But we are still in the grip of this virus. We're not alone. Again, I don't expect that to make people feel better, but the world is still living with this, and we don't have to look very far to see the implications of it for people in all parts of the UK as well as across the rest of the world. So tough though it is, it's in the interest of all of us and of those we love to stick with it. And I think as we go through this next period, all of us in a sort of national collective endeavour, and I include the media here, who've got a vital and important job to do of scrutiny, but can also help us get the message across that for the next period, it's really, really important that we all try as hard as we can to stop the virus spreading and stop it taking any more lives than absolutely necessary. Mark McLaughlin from The Times.
Afternoon, First Minister. Looking at the latest Public Health Scotland release about the contact tracing, and top of the contact tracing was people who attended childcare or education settings, the same amount as people who attended healthcare, twice as much as people who attended social care, and 3 times as much as retail. Now, I know places like healthcare are essential, but are schools still essential for this last few days, this last week coming? Particularly as the last week is traditionally in any normal year a kind of winding down week where children would play games, watch videos, something like that. And if so, if you are going to keep schools open, would you encourage teachers to use every single last minute on education rather than playing games?
I'm not going to try to tell teachers how to do their jobs in their classrooms. They're qualified and trained and expert in that. That's not for me to tell them. I do think educating our kids is essential, and I think Having them in school is essential to their education and their well-being, and so as far as it is possible to do that, we want to maintain that. The phrase "at all costs" has been used, and if I have used that phrase, which I'm not convinced I have, then it's not one that I should have used, because I think it gives the wrong impression that we don't care about the safety of young people or teachers. Of course we do, but as far as it is possible to do, I do think we should try to keep young people in school, and that's what we've been very clear about, and that has implications for the rest of us. It means that adults probably have to live with greater restrictions sometimes in order to try to make that possible. But we continue to think very carefully about all of these decisions literally every single day. In terms of the Public Health Scotland report on contact tracing, and again I've made this point previously around hospitality and retail, the fact that people are saying that they've been in certain places in the days running up to testing positive, of course, does not mean that that's where they got the virus, because we can't be sure about that. It will also be the case that as we have had for a large swathe of the country, retail closed, non-essential retail closed over the past 3 weeks, hospitality is severely restricted. We've had fewer people frequenting places like that, so the other places that people go will almost by default come up that list of places that people are mentioning. Now, we look carefully at all of that, and we'll continue to try to reach balanced judgments that are in the overall interests of young people, but the country as a whole. I don't know if you want to add anything, Gregor.
I think the only thing I would want to add, just in addition to what you've already outlined there, is that we shouldn't assume that by moving to either an online model of learning within schools or by closing schools is that we're going to remove the risks of younger people coming together and spending time with each other and spreading infection between themselves. There's certainly a lot of evidence that most of the infections that are associated, particularly with that older age group of young people, are transmitted in social settings rather than in educational settings. So, as I say, I don't think it's a guarantee that we would prevent those infections from happening. And likewise, I think there's also considerations that we must always bear in mind about the continued education and life chances that creates for people, and also making sure that we're safeguarding those children who are vulnerable as well.
Scott McNabb from the Scotsman.
Thank you, First Minister. On the call to postpone the Christmas office parties this year, is there any concern about restaurants and pubs being stringent enough when perhaps larger groups roll up for meals or drinks to check that no breach of COVID restrictions is taking place? And would there be any engagement plan to target hospitality establishments to make sure they're on top of this issue over the next week or so?
There is ongoing engagement with the hospitality sector, as there is with other sectors, and the rules around hospitality, in whatever level an area is in, will apply throughout the Christmas period, and that means limits in terms of numbers and groups of people, and all of the other precautions around face coverings, hygiene, etc., that we're expecting hospitality to take. This is a torrid time for hospitality, and I know how difficult it is. But it's in everybody's interest that we limit the ability for the virus to spread in hospitality, just as we do elsewhere, because the more we do that, then hopefully the sooner we start to restore some normality to all of this. But this Christmas, it just can't be the case that we have Christmas parties the same as normal. That doesn't give me a single iota of pleasure to stand here and say that, the opposite, in fact. But that's the reality. Every time people are coming together in that kind of way, then we are giving the virus opportunities to spread, and that is absolutely the last thing we should be doing right now. Michael Blackley from the Daily Mail.
Thank you. Good afternoon. There's been some criticism from your opponents that the Scottish Government's not been transparent about exactly how the 65,000 doses in the initial batch of the vaccine is going to be used. Can you clarify some of that now in terms of what individual groups within the top priority groups will receive? Care home operators say that they'll receive a number in the low hundreds. Are they correct to say that from this initial batch? And also, just to pick up on your comments about encouraging people to cut contact in the coming days and the run up to Christmas. Is that going to influence the decisions that you make tomorrow, given that tomorrow is the last review where changes will come into place before Christmas?
All sorts of things will be taken into account in our decision tomorrow, but we've set out the process for decision making and the factors in that previously. I'll hand over to the Health Secretary on the vaccination. I believe there is and will be, as much transparency as possible around this. We, as I said, starting from Wednesday this week, we will publish weekly figures on the progress of the vaccination programme. I've just given a figure in the course of last week. 18,000 people were vaccinated, and remember that we've got to hold back 50% of the doses we have just now because everybody needs 2 doses. So, the 65,000 first week doses is actually only just over 30,000 people that will be able to be vaccinated with those. We are following the JCVI priority list as much as possible, but as the Health Secretary has set out, one of the limitations in terms of the speed at which we will be able to get vaccine to care homes are the very stringent requirements around the transportation and the storage of this vaccine. It's not as straightforward. We have now got MHRA authority to pack down this vaccine, which is a sort of non-technical sounding word for a very technical process. And we're the first part of the UK today to get the vaccine into care homes, but there are complications around this vaccine because of those requirements that will continue to be a constraint on the speed at which we can get it into care homes. Beyond that, in terms of health and care workers, advice has been given to health boards about the order of priority, looking at patient-facing staff, those, for example, working in red COVID areas. So we will have as much transparency as we can around this, but our priority is to vaccinate as many people as quickly as possible as soon as supplies allow. And the biggest constraint on the clarity we can give on that right now is around just how many doses we will get over what timescale, because that's largely dependent on other vaccines gaining MHRA authority. But I'll hand over to the Health Secretary to say a bit more.
Just to clarify on that though, have you actually made a decision on exactly who these 30,000 people will be that will receive the first dose, and how many of them will be care home residents?
I'll hand over to the Health Secretary, but we are following the JCVI prioritisation list as far as we can within the requirements of this vaccine. So the reason why we started with health and care workers last week, starting with the vaccinators, and it took a few days to get it into care homes, is because we didn't have the authority to pack down the vaccines, which we have now. But clearly there are still some complications in terms of the geography that this vaccine, for example, has. It has to be used within a certain number of hours after it's taken out of refrigeration. So there are limitations on this, which we are working through and have been working through very constructively. But I'll hand over to the Health Secretary.
So just to repeat, just so we're all really clear about the limitations on this Pfizer vaccine, there are limitations in terms of its stability, in how long it can be transported for whilst remaining stable and under what temperature conditions. There are limitations then on the temperature under which it must be stored, and then there are limitations once you move it to how long it can be kept at 2 to 8 degrees, kind of normal healthcare fridge temperatures. Once you've diluted it, and every single vial needs to be diluted, there is a limitation, an hourly limitation on how quickly you then need to vaccinate people. So if you think about the packs coming in these 975 doses, and you think about our care homes, obviously if you took a whole pack into a care home, you would waste a great deal of vaccine. Now, none of us wants to do that. This is a precious commodity. So the packing down, i.e. being able to reduce the pack size, is a critical component in order to be able to take the vaccine into care homes, which of course is what you would want to do, because we would not want those elderly residents to have to come out of care homes to go to our current vaccination centres, which we set up in order to be able to minimise the limits that moving that vaccine have. And that's why we are bringing health and care workers into those vaccination centres at the moment. Now we've got the agreement from MHRA to the deployment method that we've introduced, we can take vaccines into care homes and do residents. But that agreement means that it has to be NHS staff who go into the care homes and vaccinate the residents. And those of you who might have heard Donald McCaskill this morning from Scottish Care, Donald made a very important point, and that is that in many of our care homes, we have registered nurses, but they're not NHS employees. So when we smooth out this process, and MHRA perhaps will agree a different process in the future, those nurses will be able to do that. So that is the process that we've got underway, and that is why at this point we cannot take the Pfizer vaccine to GP surgeries and have GPs vaccinate people. But as new vaccines come online, or we continue to find ways around the current restrictions with Pfizer, then we are constantly looking at how we can extend the vaccination programme, supplies allowing, to those who are over 80 in our communities. And in terms of transparency, the First Minister has already said that 1 week on, just over 1 week on from starting the vaccination programme, we will start to publish the information about how many people have been vaccinated. I've personally made 2 statements to Parliament to update MSPs. They've received very detailed information on as much as we can be confident we're saying at this point, as well as the bigger programme. They will get more information in this week and into the following week. And if Parliament agrees, I will make an update before Parliament stops for Christmas. So we are being as transparent and open as we can about all the process. We've shown them all the plans that we can be sure of at this point, because those plans are entirely dependent on the vaccine coming through and the supplies being confirmed, and we hope very soon other vaccines, the Oxford AstraZeneca and the Moderna one being approved, which gives us more opportunity to vaccinate more people. And we've said, and we are absolutely correct about this, as soon as the supplies arrive, we are ready to vaccinate.
When this vaccine was first authorised, there was no guarantee at all that as soon as today we would be able to get it into care homes. And the fact that we are able to do that today is down to a lot of very difficult and very intense work by our pharmacy officials working in the Scottish Government. And I want to take the opportunity to thank them for that, because it has been a huge undertaking getting the MHRA authorisation for the particular deployment method that we are now using. Simon Johnson from The Telegraph.
Good afternoon, First Minister. I wanted to ask about the public health advice that you received prior to last week's Levels review. A briefing paper has been passed to me which says on the City of Edinburgh, you were advised that there had been a substantial improvement in indicators for Edinburgh, consistently downward into level 1 range for cases, and a sharp drop also in test positivity. And that NHS Lothian's Director of Public Health had recommended a move to level 2. Case forecast now very low hospital forecast for NHS Lothian. In contrast, in Aberdeen, it said a deteriorating situation measured by multiple metrics, situation not fully under control by current measures, additional control measures are required. I just wanted to ask, does this add credence to the criticism that you've received in recent days in some quarters that you're not been following the science in these 2 cases? Also, you have noted there has been a slight increase in cases in Edinburgh in recent days. I just wondered if we should expect an increase in university towns and cities linked to the mass testing of students prior to their return home for Christmas. Thank you.
No is the answer to that question. The lateral, what we announce in these figures are PCR tests. The students are lateral flow tests, so they wouldn't account for this. And of course, we will publish the detail on lateral flow testing. I set out the reasons for these decisions in Parliament last Tuesday. I also set out the fact that the indicators are part of the decision-making process, but we have to apply context and judgment to those to reach our final decisions. Of course, there was a court challenge to the Edinburgh decision at the end of last week, and a judge on Friday night issued a judgment saying that the decision-making process of the Scottish Government was rational, and it expressly noted that the Scottish Government had always made clear that it had to be a rounded decision. Looking at the most recent figure, so the decisions in Edinburgh are tough and unpopular. I don't shy away from that. But if I look at the data since last Tuesday, then I have to conclude that the decision we took last Tuesday not to take Edinburgh down a level was actually the right one. If I look at the most recent data, and I'll see another iteration of this later today, but the most recent data says that in the 7-day period, cases in Edinburgh increased by 33%. The test positivity is now almost at 5% again. And when we took the decision last Tuesday, and the reason that we took the decision we did is we were already starting to see that edging up in cases. And the judgment I and the Cabinet made, and I think it is the right judgment, that when you're starting to see that kind of increase, it would not be a sensible thing to do to ease restrictions. It would be like, I guess, pouring petrol on, sort of smouldering embers. So, that's the reason why we reached these decisions. I have to say, looking at the rest of Lothian, Mid Lothian and East Lothian, which of course we did take East Lothian down a level a few weeks ago, we're seeing cases rise across Lothian right now, and that is not something, difficult though it is, we can simply ignore when we reach these decisions. I also set out the reasons for the decisions in Aberdeen City and Aberdeenshire, that we were continuing to look at that closely. We know that there have been some specific factors in these areas. Care homes have been mentioned, but as I said earlier on, we are not necessarily convinced now that they explain the whole situation in Aberdeen and Aberdeenshire. So we'll be looking carefully at those areas today as well. These are not straightforward decisions, and I appreciate that people living with the consequences of them, it is far from straightforward for them too. But this, and I've said this many times before, it would be much easier if it was just a simple algorithm, but it's not. We have to apply lots of judgment to try to get these decisions as right as possible, to stop situation deteriorating, or where we do see a deterioration, to try to act quickly to stop it getting worse. And that's the approach we'll continue to take as carefully as we can.
Then Edinburgh will not be going down to tier 2 tomorrow.
I'm not giving you a particular steer one way or the other. I'm setting out the factors we take account of. I think people can draw their own conclusions from some of the data I've just shared with you, although I will see more up-to-date data later today. But I'll set out the decisions that the Cabinet will only reach tomorrow morning in Parliament tomorrow afternoon. Alistair Grant from the Herald.
Hi there, First Minister. Thanks very much. Just to follow on from a couple of the questions that were asked, firstly, just Simon's just there. Why was the public health advice or the recommendation not made public in the papers published by the Scottish Government? Why not be, I guess, open about it? You've often said you want to treat the public like adults. Omitting it arguably doesn't do that. And just to follow up, and I think it was Paul asked earlier on about the £500 bonus and council workers. Were you suggesting that the council should look at maybe replicating the £500 thank you bonus?
I wasn't saying anything one way or the other. I was making a statement of fact that the workers Paul was asking me about are council employees, but I wasn't. It's not for me to give an opinion to them one way or the other on that. On the public health advice, we've set out our decision-making process very clearly since we published the levels approach, and actually, a court looked at that and made the judgment it made on Friday. But I was getting asked questions in Parliament last week about the public health advice, so the idea that it was somehow hidden and not known about, I don't think stands up to much scrutiny. But it is part of the overall judgment that we make. We get advice and views from the National Incident Management Team. They will usually give us views over a weekend ahead of a Tuesday decision. We will get updated views and advice on a Monday. The Chief Medical Officer will consider that with the National Clinical Director. It then goes through what we call a 4 harms analysis with other senior officials to look at the economic and social impact of any restrictions that we're considering putting in place. The Chief Medical Officer is part of the Cabinet decision that we reach every Tuesday. So that process is set out there, and we take it as these decisions as carefully as we possibly can, But inevitably, when we're trying to control a virus, there is a degree of judgment that we have to apply. And part of that judgment is to be cautious and precautionary in what we're doing. And I thought, because I obviously, as part of the cabinet that took that decision, was part of it, and I stood up in Parliament and announced it. I thought we were right last week not to ease restrictions in Edinburgh, but if there was any doubt about that, that has been dispelled in what has happened to case numbers in Edinburgh since then. It would simply be a risk that I don't think would be right to take on a rising trend of cases in the capital city to substantially ease restrictions, because in 2 or 3 weeks' time, what people in Edinburgh rightly would be saying to me is not why are you not taking us down a level, but why did you take us down a level, and now putting us in a position where the virus has run out of control and we're perhaps having to go up a level. So I know these decisions are not popular. I'm not... If I was taking these decisions to be popular, I would perhaps be coming at them from a different perspective. I'm just trying with my advisors and cabinet colleagues to do the best we can to keep the country as safe as possible as we get through the remainder of the pandemic. Do you want to add?
Yeah, I mean, the first thing is to emphasise the multiple layers of advice and decision making here, and there are very fine and difficult decisions that are made all along that process in terms of how we form that advice, so that ministers are able to then take the decisions in relation to how we approach these levels. I've been dealing with this virus now for 10 months, and I've learned an awful lot about the virus and the way that it behaves in that time. And the one thing that I'm absolutely sure of and clear about is that at any point you become blasé about it, or you begin to take your eye off it, then it will come back and it will cause problems again. And it's right that we adopt a cautious approach at all times. When you start to see rising numbers in any one area, particularly associated with a rise in that percentage positivity, again, that gives me cause for concern. It means that I would always want to be that bit more cautious in terms of how we approach that. So I will continue to give public health advice to ministers based on those precautionary principles, because I think that that is the right thing to do. My absolute priority is to make sure that we do all that we can to safeguard our population.
And the last question today is Richard Percival from The Express.
Thank you, First Minister. I just had a quick question on the royal visit from last week. There was some indication over the weekend that Prince Charles, who visits Burkhill, part of his Balmoral residence, every year at Christmas, decided to cancel because he sort of felt an unwelcome impression about the Scottish Government. Have you had any communication with Clarence House at all on a visit by His Royal Highness this year? Do you have any advice on any future royal visits that could be planned? Thank you.
I have had no contact with Clarence House. I have made no comment on Prince Charles's Christmas arrangements. All I do every day is stand here and remind everybody what the rules are that are designed to keep all of us safe. And many people will not be travelling in the way that they would like to travel to see loved ones over Christmas and not be spending time with loved ones. Nobody likes that, and that's not about people, whoever they are, not being welcome here. I think Scotland is one of the most welcoming countries in the world, and I'm well known for wanting to encourage people to visit Scotland, to come and study here, to come and work here, to come and live here. But this is a global pandemic of an infectious virus, and unfortunately that puts restrictions on how all of us are living our lives right now, and nobody likes that, but it is just the reality we are living through. And that concludes the questions for today. Can I thank the journalists? As always, my thanks to Jill for our BSL interpretation, to the Health Secretary and the CMO for being with me for the questions today, and thanks to all of you for joining us. Please continue to stick to all of these rules. It is really, really important as we go into this next period that all of us make a concerted effort to stop this virus spreading. And I know it's difficult, but please think very carefully about the plans you're making over the next couple of weeks as we go into the festive period. We don't want to be spreading this virus over Christmas. We don't want to be putting ourselves or the people we love at risk. So it's going to be a difficult time, but please be cautious and think carefully about the things that you're doing. I will join you tomorrow from the Scottish Parliament at the later time of, I think, around 2:20 tomorrow afternoon, when I will set out the outcome of the weekly review on the allocation of levels to different parts of the country. In the meantime, stay safe. Thank you very much.